Joining us, hopefully once again today. I had just a few things that I wanted to cover very quickly before we turn over and get the latest on-the-ground updates from Dr. Box, and then turn to my partner, Lieutenant Governor Crouch, for multiple updates in your house of business, so to speak. We'll also hear from Dr. Dan today, and we'll hear from Dr. Sullivan on some progress that we've made building bridges in various respects. But first, I just wanted to point out that we started earlier today, this morning, in fact, our second phase of the study that we're doing in partnership with Fairbanks. And this is, I just want to encourage everyone that if you get contacted, to please participate in this process. It is kind of our eyes. We'll be doing a sample of 5,000 again. We did about 4,600 plus. In phase one, but this is that second phase of 5,000. So this helps us determine the true spread of COVID-19 here in the state of Indiana, and it helps us guide our plan. And so if you are contacted again, please participate. Already we launched this morning, and I think your report earlier today was where we're over north of 2,600 Hoosiers who had said yes and opted in to take us up on this. So much appreciation. And then secondly, I guess I'll say a word of thanks here before everyone else presents. I do want to thank all the peaceful protesters who have been not just protesting but demonstrating for a very, very important cause. It is those who seek to strengthen the very fabric of our state, which includes many colors, that we owe not just our attention, but we owe our action. And so, as I mentioned a few days ago, Monday, that our state administration, our state government, was going to be looking out agency by agency to see what more we could do, and we would be reaching out to stakeholders to build out a statewide coalition. This is going to include people all over the state of Indiana. But I just, upon further reflection after Monday, for some reason, it occurred to me that back in 2018, I had the opportunity of a lifetime and a real privilege to join men and women on an honor flight out of Lafayette, Indiana, to Washington, D.C. And we toured some of the memorials and monuments. And the one that I was drawn to, being a Lincoln fan, was, of course, the Lincoln Memorial. I went there not specifically to just pay tribute to the great emancipator, but to also go up 18 steps where Martin Luther King delivered that summer of '63 I Have a Dream speech. And I would just recommend that if you Google that speech and listen to that speech again, I don't care if it's the first time or the 50th time that you've heard it, Martin Luther King Jr., Dr. Martin Luther King, spoke to 6.7 million Hoosiers in a what seems to be eerie today, but prophetic way then. And he connected with so many different emotions in America, but so many of those same emotions still are percolating and somewhat overflowing today. He spoke to 250,000 people live there that day in August. And he spoke about his optimism, his knowledge or belief that the Bank of Justice was not, in fact, bankrupt. That there was a promissory note written by our government, enshrined in our Constitution and our Declaration of Independence for all. And it required us, and he reminded that it was all of us that had to come together, that not to drink from the cup of bitterness or hatred, but to come together. These words apply today. He said that this was the beginning. He was talking about this in 1963, 100 years after the Civil War that was trying to tear our country apart. And so I would just ask, it will do you good. I don't care who you are. If you listen to every single word, it won't take you more than 15 minutes. Read it and listen to it again. and it will help us guide through this moment of our history as well. And with that, I will turn to Dr. Box for your latest updates.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 511 additional cases of COVID-19 in the state of Indiana, which brings to a total 35,712 Hoosiers known to have had COVID-19. We also saw 10 additional confirmed deaths. To date, 2,032 Hoosiers have died of COVID-19 in our state, and another 175 are believed to have died from this disease based on their clinical diagnosis. Our ICU bed and ventilator capacities are holding steady, with 41% of our ICU beds and more than 83% of our ventilators still available. We also have seen 200,077,815 Hoosiers tested for COVID-19, up from just over 235,000 a week ago. While it's encouraging to see the number of people tested increase, we want to see those numbers go even higher. The only way we will truly understand how widespread COVID-19 is in our state is for more people to get tested. Getting this information is really critical to guiding us as we move through the stages 4 and 5 and the next steps of reopening our state. While testing was a challenge early on because of limited supplies, that situation has changed significantly. Today, more than 200 testing sites are open around the state of Indiana. More than 80% of our counties have a testing site. Many of them are free, including our ISDH-sponsored testing sites and all of our drive-through clinics. Many of these sites still have plenty of room to take individuals. And as the governor already mentioned, the second round of testing for Fairbanks study started today. So please come and get tested. I also want to provide a quick update on the amount of PPE, test kits, and other supplies that the State Health Department has received and distributed. The supply chains for hospitals, EMS providers, and other facilities have opened up, allowing them, in many cases, to fulfill their own PPE needs. This has allowed us at the Indiana State Department of Health to begin to build inventory that the state might need in the future, such as if we see a big second wave of COVID this fall, along with our flu season. We will continue getting PPE to hospitals in need that are unable to have their orders filled. For example, as of Friday, we have distributed more than 5.8 million pieces of PPE across the state. We've also distributed 9,189 vials of remdesivir. As I've said before, Indiana likes to be able to take care of our own needs. And through incredible partnerships and work across many state agencies, we feel that we are better positioned to do this than when this pandemic first hit. I'm going to turn things over to Dr. Dan in just a minute to discuss some of the new CMS data and other steps that we're taking in our long-term care facilities. But before I do that, I wanted to let you know that I've been asked whether I'm concerned about an uptick in COVID-19 cases due to the large gatherings that we have been seeing take place. Of course, I'm concerned. So I just ask, as you're gathering, please take precautions and be cognizant of the fact that you could be spreading COVID-19. Dr. Dan?
Thank you, Dr. Box. Dan Rosiniak, Chief Medical Officer for Family Social Service Administration. So on Monday, CMS came out with data that was aggregated by state on nursing home related deaths. And it would not take a lot of statistical know-how to look at their numbers and the numbers we have on our dashboard and see that there's a difference between the number of deaths that they're reporting and the number of deaths we report. It's about 200. And like you, we saw this data on Monday when it was released. We are currently looking into these differences and trying to figure out how we get closer to the real number. I think one of the likely possibilities that exists for these differences is that these two systems were designed for very different reasons. So our focus from the beginning of this pandemic when it comes to long-term care facilities has been how do we prevent and mitigate outbreaks. And as part of that, we created our strike teams, we used our infection control experts, we repurposed our surveyors to go to facilities early whenever we heard about new cases. And as part of that, early in April, we recognized that there were outbreaks that occurred in long-term care facilities that we didn't hear about until numerous cases had already arose. So as part of that, that's why we created on April 10th and implemented the Commissioner's order that all long-term care facilities have to report to ISDH any new COVID cases or deaths in residents within 24 hours of their knowledge. This system would give us a better real-time monitoring, event monitoring for identifying outbreaks. And as part of this, we created an online data collection form that's similar to what we have used in other outbreak situations. Now, when we created this form, we, before implementing it, asked all the long-term care facilities to give us their totals for deaths and cases. Now, this was a quick one-time assessment to get a baseline, and it's possible that the facilities were not able to accurately account for and report the deaths at that time. The CMS requirement has been known now for well over a month, and as such, facilities have likely had a lot more time to go back and accurately count and report these cases. I'll also mention that CMS itself, as recent as an hour ago on calls, has acknowledged that the data in their systems is unlikely to align perfectly with the state's data, and that it may not, in part because of the way the data is collected. Now, we're going to continue to look into the differences in our two systems, and we're going to work to transition away from our online reporting form and to using the same data the same way as CMS to better align our numbers with theirs. I will also mention we do not believe that those 200 deaths have not been accounted for in our totals. The way we collect total deaths for our dashboard is through a different process, and we do not believe that there are 200 missing deaths from the total count. It's much more likely an underreporting problem, or it's much more likely a problem of not attributing it to a nursing home when it might have occurred in another location. I'm going to talk just briefly about some new guidelines that we're going to post today on visitation in long-term care facilities. When CMS recommended restricting visitation in these facilities, ISDH, like every other state, followed suit. And the reason we did this was to prevent people from entering these facilities who might have and therefore spread COVID-19. These restrictions, however, are not without consequences. We recognize that isolation has serious impacts on the health and the well-being of the residents in these facilities. Now, until now, the focus on keeping individuals connected with their families and friends has really centered on the use of technology, whether that's FaceTime or other web-based platforms. But this does not fully substitute for an in-person visit. And now, while the congregate nature of a nursing home can amplify the spread of COVID-19, recent evidence in the scientific literature has shown that transmission risks are much lower outdoors. We believe that the risk of COVID transmission in long-term care facilities and the need for family partners, close friends, and those interactions can be balanced. And that is why we are releasing guidelines that will outline how facilities can, under certain conditions, allow families and friends to have outdoor visitation with the residents in long-term care facilities. These guidelines will take into account the COVID rates in both the community and the individual facility. And let me say up front, this is not a final solution. We recognize that this will not allow everyone in a facility to be visited at this time. This is just a first step. ISDH and FSSA will continue to work with our partners in long-term care to develop a series of steps that will bring us closer to a time when all family and friends can once again visit those they love without a restriction. Lastly, I want to comment a little bit on testing in long-term care facilities. In the last 2 months, we have seen a steady decline in the number of new cases and deaths in long-term care facilities. At the same time, we have significantly grown our testing capacity. So now we believe we are in a position to do widespread testing of nursing home staff. This will be a really important step in preventing future outbreaks. We know that the majority of COVID-19 outbreaks in long-term care facilities occur when a staff member contracts the virus and unknowingly brings it into the facility. This is one of the most difficult aspects of this virus. People can transmit it without having any symptoms. The close contact between the staff and residents then likely facilitates the spread. And while infection control measures like wearing PPE and hand washing are critical at preventing the spread, they are clearly not enough. So this is why we're going to test all the staff working in nursing homes in June. To do this, we're working closely with our Long-Term Care Association, our statewide testing partner, the Indiana National Guard, and our strike teams to go to every skilled nursing facility and test all the staff. This point prevalence survey will tell us how many staff in these facilities test positive for COVID-19 but have no symptoms. And the data we collect from this and the Fairbanks study together will better inform us on who in a nursing home needs to be tested, and then in the future how frequently that needs to occur. Like we have done with all of our COVID responses, we will collect the data and we will use that to inform us on what we need to do next. Thank you.
Thank you, Dr. Dan. And Lieutenant Governor Crouch, you've got some updates on home energy assistance and assistance to local governments, and I think some progress on our broadband front.
Yes, Governor, thank you for this opportunity to provide some updates on the ongoing work of some of the agencies I oversee as Lieutenant Governor. During this time of uncertainty, housing stability has never been more important to Hoosier families. Our Indiana Housing and Community Development Authority received an additional $17 million from the CARES Act for the Low-Income Home Energy Assistance Program. Now, if you're a Hoosier and you've lost your job or have seen decreased hours due to COVID-19, you may be eligible to receive a one-time benefit of $350 to assist in your utility bill. On the average, this will cover about 2 months of utility service. This benefit is available both to individuals that have already received an energy assistance benefit or to new individuals who have not yet applied. Applications will be accepted now through July 31st, and for more information and to see if you qualify, please call 211 or visit the website on the screen. In April, 62 rural communities received more than $10.7 million from the Office of Community and Rural Affairs, or OCRA, as we refer to it. Now, in order to support Hoosier businesses, we are launching the long-term recovery phase of the COVID-19 response program. And this will allow for eligible local units of government to apply for up to $250,000 in funding. These funds can be used to provide either grants or loans to businesses so that they can continue their operations and keep employees working. A local unit of government can use an existing revolving loan fund or create a new one, or they can implement a grant program. These funding streams can be used by small businesses with 100 or fewer employees, and even businesses as small as micro enterprises with fewer than 5 employees could qualify. Each business will receive between $10,000 to $25,000 in either a grant or a loan. So if you are a local community interested in learning more, I encourage you to attend a webinar hosted by OCRA tomorrow from 10 to 11 Eastern Time. Reach out to your community liaison or email OCRA for more information. Applications will be open from June 8th to July 19th. And we encourage you to reach out with your questions on how best you can help your business community. Governor Holcomb, you have always placed a priority on access to fast, affordable, reliable internet service. And COVID-19 has driven that need home now more than ever. People need to connect with their loved ones. We need to receive telemedicine services, do e-learning, telehealth, unemployment applications, and so much more. In 2018, the governor launched a statewide infrastructure program, the Next Level Connections, which seeks to connect Hoosiers to each other and to the world. From that stemmed our broadband program, which was awarded $100 million to bring Hoosiers out of internet darkness. We have already awarded over $28 million to 14 projects that spanned 18 counties. This funding will provide infrastructure to connect over 11,000 Hoosier family and homes. Currently, in round 2, we received 72 applications for a total of almost $100 million in funding. The applications come from 21 different service providers in 47 counties. Okra is currently reviewing the applications, and we expect to make more announcements here in July. But what I'd like to do right now is introduce a special guest, Ron Holcomb from Titmount REMC. Well, I understand he's no relation, Governor, to you.
Cousin Holcomb.
Like you, he is focused on getting the job done. And they received funding during round 1 to connect the Tippecanoe County area. And out of the 14 applicants, they are the only one to date who has been completed their project. So welcome, Ron. Thank you for being with us. And as a rural electric membership co-op, you historically provide electricity to customers. So what caused you to pivot and decide to get into this broadband space?
It was driven by our consumer demand. We did about 2 years of market research work to understand where the gaps in our community were. We had an outpouring of interest from our members because of the lack of adequate broadband, especially in the rural areas that we serve. And then coupled with that, we commissioned a study to be done by Purdue University for us to understand that if it's economically viable for us to enter into this space, what is the actual economic impact on the community given the investment? And that study was overwhelming because it demonstrated that for every dollar that we invested in this infrastructure, that we were able then to generate over $4 of value back to the community in economic stimulus over the course of the project. So with that information, the board and I took a look at it and we reimagined who we were. So we have now transitioned from an electric cooperative to an essential services cooperative, recognizing that key infrastructure on many levels is needed across our service area.
Thank you. And can you talk a little bit about the Next Level Connections initiative and what that means to your programs?
Absolutely. So first, let me thank the governor, you, your administration, the legislature, your staff. This is a fantastic program. And a moment ago, Dr. Box made the comment, and I wrote it down here, that says, we take care of our own in Indiana. And that's exactly what this program does so well. We have areas in our service area which are very rural that we're quite aware of here in Indiana. And accelerating the builds, the broadband builds in those areas is greatly enhanced by the Next Level Grant program. So I strongly encourage you, the governor, and others to continue to make these kind of investments in these rural areas so that they can then participate in what we have now learned to become the American way of life, which is we need electricity, we need water, we also need broadband.
And what's the status of your project? How exactly has it benefited the people in your area?
Yes, so we look at our projects in terms of zones, and we have to evaluate the feasibility of each zone. And oftentimes what's required is simply a modest investment in additional capital to actually make that zone work. And so what the state was able to do with this grant program in partnership with Titmount is to make this service now available to over 500 Hoosiers in our area that otherwise would not have had service And that service availability started actually in February. So we were awarded the grant in this last summer, and by February, service is already up and running.
And what is next? Do you plan on expanding broadband in your region?
Absolutely, we do. It's clear that economic development is a regional effort. It's not just Lafayette, West Lafayette. It's not just Fountain County. It's all of that. And it's important that we know that we can all connect collectively such that we can build our local economy. So we have made a very strategic investment in a company called Wintech Corporation. Wintech is a boutique broadband provider in Lafayette. They're now part of the Tipmont team. In fact, we brand our internet services as Wintech across our entire footprint. Wintech provides services to Lafayette, West Lafayette, Purdue, large companies, and it has provided us with a great foundation to be able to grow from the point we are today to become a regional hub of high-tech capability for everyone.
Hey, Ron, is there anything you'd like to add, or is there anything we've missed?
I would just encourage the governor and you and the rest of the state to continue to work on this critical need. I recently went on an install with some of our installers. We were doing this thing called the DIY install during COVID-19, where the customer actually helps do the install and we don't enter the home. So that was quite a feat to figure out. So I went on the first DIY install, and once the router hit and the service was available, we could see the kids in the garage, and I called it cheers and tears, right? There were cheers from the kids and tears from the parents, so that's what it's about.
Well, thank you, Ron. Thank you for being here and sharing that with us. And Governor, thank you for your leadership in this area and your partnership always.
Teamwork. Well, I will refer back to something that Mr. Holcomb said when he was talking about reimagining government services and delivery. And Dr. Sullivan, you've been doing that your whole life, especially in the current post that you occupy. You want to give us an update on multiple areas of service and delivery.
Good afternoon. I will keep my remarks brief or talk quickly or both. Thank you so much for having me today. Jen Sullivan, Secretary at FSSA, and as always, thank you, Governor Holcomb, for the invitation to join you today and for your charge to us to help solve systemic issues. I have a few updates that are really great progress for social services and healthcare in Indiana. We start with tremendous news. I'm really overjoyed to announce that our HIP Workforce Bridge program is now approved by the Centers for Medicare and Medicaid Services. This program is the first of its kind in the nation. It establishes a new transitional phase for Healthy Indiana Plan members as they return to the workforce and to employer insurance or other health coverage. The Healthy Indiana Plan, or HIP, is our Medicaid alternative program for adults, which now provides health coverage for close to 500,000 Hoosiers. The HIP Workforce Bridge will allow thousands of outgoing HIP participants the ability to continue to use up to $1,000 from their power accounts, which are like health savings accounts, for up to 12 months to pay for premiums, deductibles, co-payments, and co-insurance as they transition to commercial coverage or other coverage. Indiana becomes the first state to establish such an innovative approach to eliminating the gap in health coverage that can prevent HIP members from pursuing meaningful employment. Because of the COVID-19 pandemic, FSSA is not currently disenrolling members of any health coverage program for any reason at all. HIP Workforce Bridge will be in place to support members immediately once the governor's executive order expires. Now more than ever, it is critical that we provide stability and peace of mind for Hoosiers, especially when it comes to matters of their health. Since February, membership in the Indiana Medicaid program has grown by approximately 72,000 people, and we anticipate that even more Hoosiers may need HIP health coverage during the emergency and as our state recovers. In Indiana, HIP is the program for non-disabled adults with no or low income, and we want to make sure that everyone who needs coverage can get it, but when they're ready, can safely transition off of HIP. And this is one of our first efforts to mitigate the eligibility cliff effect in Indiana, which is a priority across all of our programs. An update on SNAP online purchasing is next. We've been working with our federal partners to remove barriers and provide safety and convenience benefits for Hoosier SNAP recipients, particularly those who are most at risk for COVID-19 infection and those who are homebound. SNAP recipients in Indiana may now today use their Hoosier Works EBT cards to purchase groceries online for pickup or delivery at 2 approved retailers, Amazon and Walmart. SNAP participants are automatically eligible to participate in this program and do not need to apply. Because of COVID-19 and its economic consequences, we now have more than 100,000 additional Hoosiers relying on the SNAP program to help feed themselves and their families. And while this service will initially and immediately address needs caused by the pandemic, we intend to keep this service in place permanently. Amazon offers online ordering and delivery of groceries to SNAP recipients today. Walmart offers online ordering and delivery and pickup options at some stores, while other stores only allow online ordering and pickup of groceries as a designated spot outside the store. Instructions for both of these are available on the Amazon and Walmart websites, which are shown on your screen, and we link to those as well from our website at indiana.gov/FSSA. It is important to note that currently any delivery fees that may apply to the online purchase may not be paid for with SNAP benefits. I understand that this is less than perfect, and I promise that I will keep working on that part. If SNAP recipients have any problems using their card for ordering, they should call the number on the back of their Hoosier Works EBT card for customer service. Next, at FSSA, we operate a wide variety of programs and supports focused on ensuring all Hoosiers live in fully engaged communities and reach their greatest emotional, mental, and physical well-being. One of these programs is our Home and Community-Based Services Program, or HCBS. This program is implemented through specific agreements that states enter into with CMS, commonly referred to as waiver programs. These waivers support certain populations in need of community-based long-term services and supports. Indiana operates 4 such waivers that support Hoosiers with intellectual and developmental disabilities, traumatic brain injuries, and physical disabilities, as well as older adults. We implement these 4 waivers through a network of hundreds of community-based providers who employ tens of thousands of direct support professionals, personal care attendants, home health aides, and other human service professionals who work every day to ensure older adults and Hoosiers with disabilities are supported to live, love, work, play, and participate in their homes and communities. As in every state, these critical services were impacted by COVID-19, with our provider network adapting to the necessary precautions to keep people supported and safe. To support our providers and the individuals we serve, FSSA pursued program flexibilities through CMS, and we were granted those just a week ago and are very excited to make modifications to our 4 waivers to meet the needs of individuals that we support. You can find details on these flexibilities that are implemented through our Division of Aging and our Division of Disability and Rehabilitative Services through our website. And last but not least, the Division of Mental Health and Addiction has just received a grant of $1 million from the Federal Emergency Management Administration, or FEMA, to establish a crisis counseling program. These programs are typically established in certain areas after major disasters. The current pandemic has created a lot of stress, anxiety, grief, and depression for many Hoosiers, especially those living alone. Some may even consider suicide at a time of crisis like this. The protests and civil unrest as a response to racial injustice and police brutality are also likely to impact Hoosiers' mental health. A special team of crisis counselors is being set up at Indiana 211 and will be ready to take calls in the coming weeks. We will work to promote this new service to Hoosiers who are most likely to be having a stress response to build awareness of the crisis counseling program. We will also be reaching out to specific populations such as frontline health and long-term care workers and our colleagues at the Department of Correction. Again, thank you, Governor Holcomb, for your support as we build social services and healthcare supports, not only for the crisis at hand, but also for a better future. Thank you.
I feel like you need to keep going. You're just on a roll.
We're on a roll.
Great job. Rachel, you want to go right to Q&A?
Tom Davies, The Associated Press.
Afternoon, Tom.
Hello, Governor. Question is, why will the new nursing home testing program not include all residents, and will those residents need to be tested if you're going to be starting to allow visitation with family members and others?
Yeah, good question. Dr. Dan?
Thanks for the question. So right now, and we'll continue to do so, we test residents in long-term care facilities when we know there's outbreaks. The goal of this program at first is to let's identify all the staff in long-term care facilities that might be working unknowingly with COVID. If we identify a staff in a facility who has COVID, then we will follow up as we do now with our COVID plus teams to go in and to test all of the residents in that facility who might have had a direct exposure.
Meredith, WLFI.
Good afternoon, Meredith.
Good afternoon. My question is regarding the protests that are taking place. So what is your recommendation to communities that, are medium in size or small in size that saw an influx of people due to the protests? Are there concerns that hospitals could see an influx of patients, and should hospitals be doing anything to prepare for that possibility?
You alluded to that earlier. You want to?
So it's certainly a concern that we have seen. I mean, protests by nature are kind of an act of unity. So we're linking hands and arms and not really experiencing social distancing. And some were wearing masks, but not everyone. So in particular communities, that can certainly increase the risk for more infections to occur. And that is something that wouldn't be seen probably for the next 7 to 10 days with regards to number of cases that go up. Fortunately, what I saw is that most of the individuals I saw out there were in the younger age group, so hopefully those would not be as severe of infections and may not require hospitalization, but it's something that we'll be watching for carefully.
And I should also mention that we had an election yesterday as well that brought a lot of people together. And the Secretary of State, Connie Lawson, is on the line and available to answer questions as well. In addition, we've got the Superintendent of the Indiana State Police, Doug Carter, and the Adjutant General of the Indiana National Guard with us today, too, to answer questions if anyone in the press corps wants their thoughts.
Kayla Sullivan, Fox 59.
Good afternoon, Kayla. This is where Rachel says you have to unmute your phone, Kayla.
We'll come back to Kayla. Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you doing today?
Doing well, thank you. Yourself?
Pretty good, pretty good. Considering we had the election today, I wanted to ask, up here we had upwards of 40% of voters choose mail-in ballots due to the coronavirus pandemic. And while turnout necessarily wasn't more than it would be in comparable years, I wanted to ask you and Secretary Lawson if she wanted to chime in. While ultimately it's not your decision come fall, after seeing some of the returns last night and just the response to mail-in voting, would either of you be supportive of continuing the no reason mail-in voting come fall?
I'll turn it over to the Secretary, but I'll just say this. I did vote in person. The Secretary and I sat at this very table when I confessed of my intentions early on, and I can tell you what my eyes saw at the place where I voted was it was a very safe environment. There was all the PPE that the Secretary said that she would make sure was out at every polling site was there. Folks were masked up where I voted, and I stood in line for about 35, 40 minutes. And so once again, this is a safe option, and I'll leave those further. We're still counting votes, by the way, so before we weigh in on the next election, we need to land this one. But I know from the turnout yesterday in person that option is critically important to many people. Secretary, you want to elaborate?
Sure, Governor. Thank you very much for having me. Steve, that's right. The results aren't even in yet from yesterday's election. We've got counties still counting, and we'll be doing some debriefing, in fact, a lot of debriefing, and we'll be talking about lessons learned and what went really well and what maybe we need to improve on. But mostly we're going to be asking about how do we all work together in the future to make our elections even better. So we're not going to make those decisions yet. But my goal would be to have a normal election in November with normal absentee process, 28 days of early in-person voting, and voting on Election Day. That's my goal.
Thank you.
Kayla Sullivan, Fox 59.
Back to you, Kayla.
Hi, sorry about that, Governor. So my first question is for Dr. Box, and then I have one for you, Governor. But for Dr. Box, for months, the state has been telling people not to gather in large groups, and I know you have addressed this briefly in the beginning, but, with leaders today hosting prayer services for the public to gather in person, do you agree with some who say this creates a double standard? And what do you urge leaders to do when they're faced with the tough decision of keeping people safe from COVID-19 right now, but also addressing racism and bringing people together in person to create change?
Well, Kayla, I support our church's ability to gather individuals together as long as they do that in a safe fashion with social distancing and wearing of masks, making sure that they aren't having a big congregate meal together. Those are the things that concern me the most. And I understand with the protests that have occurred, that unity that is needed with regards to being able to make their voices heard. But I do believe that the best way to protect themselves would be to carefully wash their hands, alcohol them with something that's got at least 60% alcohol in it, and wear their masks. And that's so critical, especially when we have individuals coming in from outside this community in this area.
Thank you. And then my question for the governor, considering you and Dr. Box have both said that a second wave of COVID-19 is possible in the fall, are you planning to make the November election a no-fault absentee ballot election so counties have the maximum amount of time to prepare? Why or why not?
Yeah, too early to say, but I can just tell you where I land is what I saw yesterday was there were safe multiple options to vote in person. What we did yesterday was prove that that was possible. And so that's where I lean right now. But again, we're still counting votes, so to be determined.
Sherry, the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. I was wondering if you have met or have any plans to meet with any of the individuals who have been protesting both outside the gates of your governor's mansion as well as downtown and Monument Circle?
Have not so far. Wouldn't rule it out. I don't want to be counterproductive. I want the folks who are demonstrating and protesting for what I said was a very noble cause to know that we are not just hearing them, we are acting. And I hope that other governors around the country, I know they are, but I hope there's follow through on this front. And mayors, by the way, elected local officials. A lot of the grievances that are being exposed land in a very local level. Now, what our administration is doing, and what I alluded to on Monday as well during this Q&A portion, we're working with our administration. We're working with stakeholders around the state. This is not something that's just superficial, that is some slick rhetorical or a bumper sticker that you just slap on and say, there, we're working on this. This is substantive. And it absolutely speaks to what Dr. Martin Luther King Jr. said. He talked about the fierce urgency of now. He talked about that in 1963. There is a fierce urgency of now still. And so we're looking agency by agency. We have done more than just acknowledge the problem. We're seeking to be part of the solution to that problem, our part of the world as a state. And there is a federal component to this and there is a local component to this, but we're not only going to acknowledge or admire this problem, we're going to, again, assemble that stakeholder group. We're going to establish goals, make sure that we're applying the proper amount of resources to actually move the needle. In fact, we're going to learn a lot about some probably programs that are there right now where there are barriers, where it, we have financial resources being steered. I mentioned some of those, whether it has to do with our infant mortality rates around the state of Indiana, how we bring that down. I talked about next level jobs and skilling up and training programs that we're funneling dollars to. I talked to Dr. Sullivan, just talked about some updates for the Healthy Indiana program. And that bridge program now, we're devoting dollars now. We're paying for college. Now, are all those resources and those dollars from a state perspective, again, just speaking for our little patch, Are there barriers there that need to be removed? Are there different programs that need to replace them? The good news is we're a state that we went into this pandemic with a lot of resources and a record high employment, a record low unemployment. Our problem was, and it still will be around the world, skilling up people to fill the job opportunities that are there. And so that's what we're seeking to do. And then, of course, like we do in our agencies on a regular basis, we're going to measure the outcomes. And so, again, this is not something that you just reflexively put out your agenda, but it will include hearing from stakeholders, including upstairs, and I hope, and am encouraged, because I've spoken to some already, that there is that same fierce urgency of now throughout this building, in city halls, in town halls throughout the state of Indiana, and we will, as I said Monday, be a leader on this front as well.
John with the Elkhart Truth.
Afternoon, John.
Hey, Governor. Thank you for taking our questions today.
Sure.
Elkhart County has saw an uptick in the number of cases over the weekend, and the number of cases continues to rise, as well as the percentage of tests that are coming back positive. At what point does the state or should local officials hold off on reopening the economy or impose new restrictions?
Yeah, good question, John. And you talked a little bit about this, but in addition to answering John's question, could you also expound or expand the conversation just a little bit to talk about that percentage of positive cases and tests and how that's actually gone down? But
right. So specifically with regards to Elkhart County, you have a lot of very active individuals there that have reached out proactively to ISDH, and we have been partnering with them, your county counselors, your local health officer, and I think we have a meeting maybe coming up tomorrow to discuss this with your mayor. So we have been in discussions. There has been more cases in the Latino population up there, and through our individuals who had been wanting to be a part of our volunteer workforce. There's a physician that is bilingual up there that has volunteered to be actively engaged with the communities there. A big part of that sometimes is also addressing their housing situations, how they live in congregate settings oftentimes. When we look at the testing, the numbers of tests across the state have definitely gone up, so the positive cases go up, but the percentage positive overall has fallen from a high of around 19 to 20% down to now 13%. Of those individuals that we are testing are positive, and in fact on a day-to-day, that's overall, on a day-to-day basis, that's down below 10%. And so realistically, we are now testing more individuals that we didn't have the ability or the opportunity to test early on in this outbreak, and that was simply because we just didn't have the tests to do it. So we are very actively engaged in Elkhart County. You have a very active community up there that's working very hard on this. With regards to what the hospital systems are doing, we do look at that on a regular basis, and at this time there is no issue with that, but we work with not only the hospitals in Elkhart, but those hospitals around that they would refer to, and would certainly have discussions if there became any concerns around that.
Nikki Kelly, the Fort Wayne Journal-Gazette.
good afternoon, Nikki.
Good afternoon. I was wondering, since county jails are required to report COVID cases and deaths to you, I've been trying for more than a week to get that data from the Joint Information Center. They keep telling me they don't have it. So can I please get the information on the number of cases and deaths in our county jails?
You got three people leaning in, Nikki, and I haven't even spoken yet. But you want to?
You go ahead, and then I'll fill in.
Yep.
Kristen Doss, Chief Medical Officer for the Indiana Department of Correction. What I will say is that we do not track or keep track of the information from our county jails. So that's not something that the Department of Correction keeps and holds and owns. The county jails across the state are aware of the requirement to report within 24 hours any positive cases to Indiana State Department of Health. Additionally, we've provided additional additional guidance by education and training for the jails. But as far as releasing that, that's nothing that IDOC has to release, and I'll defer that to Dr. Box.
Thanks, Kristen. So as those get reported, and we don't keep a specific spreadsheet because most of that testing and most of that intervention with regards to education is done at the local level with the local health department engaging. We have been engaged as a consultant. We have been engaged sometimes as actually going in and doing the testing if the local health department is not engaged there. But for the most part, that is all handled on the local level.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon.
Abdul, it seems that we're having a technical problem. We'll circle back. Elizabeth Binion, WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon, Governor. At your initiative, testing sites have been set up across the state with the firm OptumServe, headquartered in Minnesota. OptumServe testing is not currently integrated into local systems of care or outreach. If an individual is tested positive, my understanding is that he or she simply gets a phone call and that there is no communication with local doctors or service providers and no further monitoring or follow-up. Some local groups working with underserved populations have expressed a concern that OptumServe testing is undermining local testing efforts. My question is this: do you plan to renew the contract with OptumServe, and would you consider providing funding to local health departments and providers in those communities where there is an existing testing infrastructure?
You want to take all three?
Absolutely. So as you probably recall, OptumServe was an option for us to be able to get testing across the state, in the state of Indiana, where we wanted to be able to test at least 2% of the population over a month's period of time. And by setting up OptumServe in 50 sites across the state, we were able to do that very quickly. OptumServe, by nature, is basically many times going on my order alone. So many individuals come who don't have a health care provider, who are not connected to any type of a clinician. And oftentimes right now they've found that their own clinicians' offices are closed, so they are limited in their ability to get tested. So until we get to that point where we can transition this over, and ultimately that is our goal, we are trying to make sure that we have that opportunity for individuals to get tested. Individuals do have the opportunity to have by email their results and to share that across their phones or whatever device they have with their particular practitioner. And we would be happy if any practitioner has a release of information to provide that information directly to them also. In the future, we may have other ways of using OptumServe across the state, but we are renewing our contract for this, the month of June with Optum.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. I have a couple questions about nursing homes here for Dr. Box and possibly Dr. Rusiniak. One, is there going to be any sort of screening of these family and friends who are allowed to visit? So taking their temperatures before they're allowed to visit, that sort of thing in the guidance? And then, well, I'll let you answer that first, and then I'll ask the second one.
Thanks for the question. Yes, the screening will be similar to what they're doing now for anyone coming into the facility in terms of making sure that they don't have a fever, making sure that they don't have symptoms of COVID-19.
And then my second question was, how soon do you want to get every employee tested by?
The goal is to get all long-term care staff, right now just the skilled nursing facility staff, tested by the end of June. Might bleed over into a couple days into July just based on the logistics. But we'd like to get that one-time point prevalence survey of all of them in the month of June, which also will correspond nicely with the second phase of the Fairbanks study. So we'll be able to look a little bit at a regional level as well to see how those two things correlate.
Sandra Chapman, WTHR.
Good afternoon, Sandra.
We'll circle back to Sandra. Megan with RTV6.
Good afternoon, Megan.
Good afternoon, Governor. I have two questions for you. Both are about the ongoing protests in the state. First of all, there are reports that on Monday, the president told governors to, quote, dominate the streets and take almost a military approach against some of the protesters. So my question is, what was your response to that? Did you say anything on the call Monday, and what can we expect to see here in our state? My second question, there was a group of peaceful protesters that made their way up Meridian to your residence earlier this week. Many saying they want to know that you see them, you hear them. What is your message to that group?
I did see them, I did hear them, and I agree with and support the peaceful demonstration and the noble cause that they are championing. I beg of them to continue. That was such a beautiful sight, quite frankly, to see folks come together where there was a line drawn, and folks on both sides of that line came together and embraced, quite frankly, and walked together. And that showed me great promise. That showed me that the peaceful demonstration could prevail, and it should persist, quite frankly, until results are shown. I understand, and I haven't been online right now or got the latest update, but I think there's some news. Earlier today was on the phone with multiple governors. The governor of Minnesota said they would have an update in Minnesota. I think there are going to be, I know there's going to be progress made, because not only do folks have our attention, we agree with them. And so I'm just begging folks to not be overrun or overwhelmed by a counter demonstration that doesn't share that end goal to make progress. And that's what I saw outside, not just my house, but downtown here in Indianapolis and in 12 cities over the weekend as well. Peaceful demonstrations. And that is what, again, not to dwell on this, I just happen to love the I Have a Dream speech as well as the Gettysburg Address, and they're very similar in many respects. But Dr. Martin Luther King talked about that there would be no rest or tranquility until we saw progress. And so that fierce urgency of now should spur action, and that's what I saw in the folks that were not just marching toward but demonstrating in front of the governor's residence. You'll have to remind me of, on the phone call I did not, I listened, and my approach will continue to be one that seeks to bridge divides and to calm the streets and to support peaceful demonstrations and expressions. This is their First Amendment right, and I want to live up to the assignment or task that Martin Luther King gave us that day. He tried to escort people, as he called it, into the palace of justice. And it is within our grasp, but it will summons all of us, of all colors and of all backgrounds, all perspectives. But we can do this, and we will.
Thank you for joining today's briefing. Governor Holcomb's next.
All right, you've been listening to Governor Eric Holcomb and state officials delivering their Wednesday briefing on COVID-19. We're also following breaking news at this hour. Prosecutors plan to charge the Minneapolis police officer accused of pressing his knee against George Floyd's neck with second-degree murder, and for the first time, prosecutors plan to file charges against the 3 other police officers at that scene on that dreadful day. The latest on this story coming up today at 5. Mike and Anessa will be back with you at 4.
Most auto insurers love when you have 2 cars, and they love it